Good afternoon. My name is Diane Mushaven, and I'm a clinical counselor in the TriHealth Employee Assistance Program.
Hi, and I'm Kate Schlauch. I am a wellness coordinator and health coach with TriHealth Corporate Health.
In the next 20 or 30 minutes, Kate and I would like to talk to you about seasonal affective disorder. We'd like to help you understand what it is, what some of the causes of it are, and most importantly, what you can do to try to prevent this or try to help yourself if you're having some of these symptoms. So, as we know, seasonal affective disorder is a form of clinical depression, and it has a seasonal pattern. That's what makes it a little bit more unusual. And so most people who experience this would notice that usually in the late fall, say October or November, they start to experience some of these symptoms. And it usually lasts about 4 or 5 months, and then when springtime comes, it clears up. And in fact, the time when the symptoms really peak is right about now, in January and February. So we're seeing a lot of that in the folks that we work with. I know you are too.
Yep.
We know that in the U.S., about 6 to 10% of Americans experience these symptoms of clinical depression due to the changing season. And children can also be affected by it. We know that women are 4 times more likely than men to experience this. And I always think it's kind of unusual, but younger people are actually more vulnerable than older people are to this. And as we talk, we'll look at some of the reasons for that. So first, I think it'd be helpful if we pull up a slide just to show some of the symptoms that people might experience if they have seasonal affective disorder. So like most types of depression, you would notice that your mood is down or low or depressed most days, almost every day. And you might have some more anxiety. You definitely would notice that your sleep has changed. You're probably oversleeping or having some difficulty waking up earlier in the day. Poor concentration or memory is a big feature of this, as well as just a general sort of fatigue and lack of motivation. People who are going through this also tend to isolate socially. They tend not to keep up with their normal activities. And because they can get more irritable, they also tend to have more conflicts in their relationships. They may also try to cope in unhealthy ways, like increased alcohol use or drug use. They also notice that there's usually a significant weight gain. And that's because people who are experiencing this have a craving for those high sweet, those high carbohydrate, sugar sweet type foods, those comfort foods. So those are some of the things that we notice in adults. If you have children who are affected by this, you would probably notice that they're fussier than normal, they're more clingy, they have more difficulty with their concentration and memory, and they particularly are going to have trouble with those day-to-day routines, but especially getting up in the morning. So if you have little ones and you notice that they're really having a tough time in the winter, some of it may be due to some of these sorts of symptoms. Whether or not it would meet a full diagnosis, it's very much in the pattern of what people experience. And so that leads to some of the discussion about what are some of the causes. And we know that the change in daylight is a prime cause for seasonal affective disorder. We see that happening in the fall. We see how the days are getting shorter. We tend to also spend more time indoors. We don't go out and exercise as much, do we?
Nope.
So, so we know that that is a big factor. And it affects some of the neurotransmitters and hormones in the body when we have less sunlight. So we'll talk a bit more about that in a moment. But I think that's a good segue into what are some of the things we can do to help ourselves if we notice ourselves or a loved one going through these kinds of symptoms. And one of those, I would say, is to get more light in your life. So, of course, one of the best ways would be exercise.
Yeah, definitely. So getting outside to get that exercise, not only are you going to get the exercise that, you know, is going to increase those endorphins like serotonin, like you said, which helps improve our mood, give us some more energy levels. But if you're able to get outside during the day to get that sunlight, that's going to give you that extra boost that you'll need to increase those levels really as much as you would need during the winter time. With exercise, not only improving those endorphins and kind of increasing your feel-good hormones, it's also going to make you gain some confidence. And especially if you can find a buddy to work out with or your friends and family, you know, you can go on a walk with them. That's going to increase your social interaction, which, like you kind of touched on, we don't get out and do much things in the winter time, and especially during a pandemic. So if you're able to find that kind of accountability partner, that's really great to, increase that social interaction with the exercise. Another thing that exercise is really great with, and it's going to improve our sleep and also reduce feelings of anxiety. So those are all really, really great benefits of exercise. Along with those, to get those, you don't have to, go outside and run a bunch of miles. You don't need to become a marathon runner. You don't need to become a power lifter and go to the gym and lift heavy weights. You really just need to get moving. So increase that heart rate, whether that be getting outside and going on a walk, bundling up just a little bit, or even doing some household chores like vacuuming is something that's just going to get you off the couch, increase that heart rate. That's all going to get you those benefits that we just kind of talked about. So those are all really great, things that you can do. Of course, getting it done in the daylight with the sun is going to help that tremendously. So that kind of leads us to, how do we get this exercise into our daily routine? Right now, I know that's really hard to do with the limited sunlight. If you are wanting to get outside to get these done, you may not have the time to do so after work. Life is really busy. So one thing that I always like to do is schedule it and make it part of your day. If you have a desk job or an office job where you're able to kind of get out for 10 minutes at a time, take those 10 minutes and schedule it into your day to get exercise in. I think that's a really great way to kind of schedule it in. At work, we call it wellness walks. So we'll kind of schedule a wellness walk where we all can take a little 10-minute break and get a walk in. So that's really great. Some other things that you can do would be just having that accountability partner and, planning it into your day. Like I said, that's the biggest thing, is planning it into your day. Starting small, making sure that whatever you're going to do is something that you enjoy doing. When you think about exercise and you're not a big runner, don't run. It's as simple as that. Find something that you like to do and focus on that. From there, you just got to stick with it, make some SMART goals, make sure it's very specific and attainable, measurable, those types of things to get it done.
I love the fact too, Kate, that you brought up that sometimes we're just not really in the mood for the exercise, and we should try to make it fun. And like you at our office, we do those 10-minute, 15-minute breaks. We just walk around the building once in a while. Or if you're working from home, that's another possibility to remind yourself that, hey, maybe at my lunch break, I'm just going to take a walk in my neighborhood. Right. Something like that.
Yeah, absolutely.
So, yeah.
Yeah, and like, we always say we recommend you getting at least 150 minutes of exercise a week. So however that kind of breaks down, typically we'll tell people 5 days a week getting 30 minutes of exercise. But a lot of times for, people who may have children, who have more than one job, that's not always feasible. So like we said, breaking that up into 10-minute increments, fitting it into your schedule when it makes sense for you is going to still get you the benefits that we talked about.
Great. Yep. And another thing about getting that light exposure, if you are a person who, for whatever reason, is just not really going to be able to make it outside, you're not going to make yourself go out enough every day, you can use what's called light therapy. Yeah. And there are special lamps that are designed for this. You can find them online. Sometimes they go by the nickname of happy lamps, sometimes seasonal affective disorder lamps, but there's a wide variety of these. The key things are, you want to look for a lamp that's got at least 10,000 lux, that's the unit of light measure. You want one that's got the UV radiation filtered out. And you want to use this lamp in a certain way. So you don't want to look into the light, they're very, very bright. You want it to shine on your face, and that alone will give enough for the light to go into your pupils. You just want it shining on your face. You want to try to use it in the first hour of the day that you're up. So that's kind of tricky because a lot of us are obviously on the move. When we get up, we're rolling out the door. Yep. But try to do starting with 5 minutes and then build up to 20 minutes. And this is a very clinically proven effective strategy for helping your mood, helping the serotonin production, maybe even helping balance out that melatonin, because that's also an area where in the winter our melatonin levels shift, which actually causes us to sleep too much because the body produces an overabundance of melatonin. So light therapy is great. The only caveat is if you have bipolar disorder or you think you might have some of the tendencies for that, you don't want to do light therapy. It has been known to trigger people into more of a manic phase. Okay. So we want to avoid that. But you also touched on a great idea about the exercise having an opportunity for greater social connections. Right. That is another of the great strategies to use this time of year, especially as we're going through the winter months during a pandemic. And we know from our work with so many clients that the social isolation that people are feeling is really taking its toll.
Yep.
That would be an issue for anybody who has seasonal affective disorder, but it's particularly bad this year. So, you know, whether it's taking a walk with people outside, whether it's even just, you know, doing some exercise with a buddy simultaneously, you know, both people working out at home in their own respective homes, but doing a workout simultaneously, that could be a lot of fun. Whatever it is, though, to help you connect with others. Zoom sessions again. I know we're all tired of meeting people two-dimensionally. We really want three-dimensional contacts, and hopefully we'll get there soon. But anything you can do to increase those contacts will help your mood. And also add in those pleasurable, enjoyable activities that, you know, when you're feeling this kind of depression, you probably don't think you want to do a lot of those things you used to enjoy. But actually pushing yourself to do that is very helpful in dealing with this.
Yep, absolutely.
Yeah. And then another strategy would be what we do in therapy is a cognitive behavioral therapy to help people kind of adjust their attitude towards winter. And I know, you know, that's a tough sell for some people because when you say winter, a lot of people say, I can't stand the cold, I can't stand the snow, it's dreary and dark. And what we try to help people do is develop more accurate and helpful beliefs about winter. And we don't ignore the fact that there are the difficulties, but we try to help people look for those days. Like today, it was so gorgeous.
Yep, absolutely.
Driving over here, the sky was so blue.
Yep.
It's wonderful. You get these rare days, or you get these occasional days. You get the beautiful days of snow.
Right.
So, you know, trying to really revamp, what is it I can enjoy about this season? Maybe I can enjoy those times by the fireplace. Maybe I can enjoy more time with the family.
Right.
All of that.
Yeah.
But those are really important strategies to work with your emotional, mental health in this. And we know from studies that treatment is actually more effective even than light therapy in the long haul.
Yeah,
So.
absolutely. And one of the things that when you were talking, it made me kind of want to touch on is when you're kind of doing these things to cope with seasonal affective disorder, there's always going to be times where you have setbacks, right? So if you're starting a new exercise routine and you maybe make a goal for yourself that you want to get outside and go on a walk for maybe 10 minutes a day for maybe four days out of the week, there might be a day where it doesn't look like it does outside right now. You know, it'll be a day where it's dreary, where it's rainy, snowy, and you're just not feeling it. You don't want to get outside, and that's perfectly okay. We're all going to have setbacks and obstacles that we have to face, but the real key here is going to have that plan of attack. So if it is dreary outside, if it is, you know, cold and snowy and you don't want to get out there, that's okay. But don't let that kind of get you off of the track of your goals. Figure out a plan of attack on how you're going to attack those barriers, knock those barriers down, and get back on your goal train, right?
That is a great point. That is very good. So we've been getting some questions.
Yep.
The first one, have you seen an uptick in seasonal affective disorder because of COVID? I mean, speaking for myself as a therapist, I have definitely seen an uptick. It's very clear to me that the combination of challenges that COVID has presented us with, especially that social isolation, has really caused an increase in distress for a lot of people. So I think just because if you're prone to seasonal affective disorder already, you already have those risk factors, and then so much of it is made so much worse.
Right.
Through
like
having to limit
whammy.
ourselves socially. People have had losses in their jobs, had losses even of family members due to the disease, losses in all that connection that we would do over the holidays. So certainly.
Yeah, definitely. We have another question that came in. So Diane, you might be able to touch on this a little bit more, but is there a difference between seasonal affective disorder and COVID fatigue? That's a great question.
Boy, that is a great question. You know, I would say COVID fatigue, to me, it looks like tiredness with all the restrictions that we've had to go through, all the changes, all the losing out on big celebrations, traditions. Certainly that is very tied to the depression feelings that somebody going through seasonal affective disorder will experience. I'd say that they kind of unfortunately combine to make the situation worse for most people.
Yep.
Yeah. How about this one? What would be the best way to help older family members with limited mobility who might be struggling with seasonal affective disorder, especially during pandemic restrictions?
Yes, that's a great question. So having that limited mobility may, stop you from being able to get outside during a walk, especially during the colder months. It's not as easy to walk in snow as it would be a dry sidewalk.
Right.
So I think that's a great question. And my advice would be figure out what they enjoy doing. If it's really just, that you guys want to come over and socially distance, wear your masks to get that social interaction, that's great. If it's from an exercise standpoint, I would definitely reach out to some fitness professional, whether that be at TriHealth, whether that be through the pavilion. They have really great resources there. Or just, a local gym, maybe your primary care has some resources you could do. But reaching out to that fitness specialist, that health specialist is really going to have some great options for you. They'll be able to assess, what mobility issues that person has, what things that they could do. Maybe you could get an arm bike. Maybe you could go to the gym and do an arm bike if mobility with the legs is not great for walking outside in the snow. There's really great options for every type of limited mobility. So I think just consulting with a specialist in the fitness field or a primary care doctor who can give you more resources. Like I said, reaching out to the TriHealth Pavilion. They have so many great resources, as I'm sure you know, and they'll be able to help you with anything, really.
And I'd probably like to add to that, too, that older people are particularly vulnerable to depression. So because of the limitations, the changes in their own health and their own independence, that can really be a factor. We certainly have seen a lot of changes over how we celebrated the holiday season, and so a lot of people have not been having their regular visits with their elders and their families. So, if you feel like your elder is struggling with their mood and maybe sounding like they're very, very depressed, I would definitely reach out to their family practice provider, their primary care provider, because in some cases we do know that people are going to need some medication to help them through their symptoms of seasonal affective disorder. So we don't want to ignore that.
Right.
Another thing about seasonal affective is that people who have a family history of it are more prone to have that condition. Or even if you have family members who have major depression, they would also perhaps, that might mean that you've got, I like to think of it as the vulnerability in your genetics that makes you more vulnerable to that. It doesn't guarantee you're going to get it, but it means we have to depression-proof you. We have to work on ways to not let that vulnerability get expressed.
Yeah, definitely. We just got another question that came through. So you mentioned before that younger people and women are more prone to seasonal affective disorder. Why is that?
Great question. There's not a ton of evidence or research on this point, but one thing about the younger people being more vulnerable probably has to do with the fact that most younger people don't have a lifestyle that really lends itself to like regular sleep routines. And one of the problems with the fall season and the decrease in light is that the normal balance of serotonin and melatonin that keeps us on a nice night and day rhythm, keeps our circadian rhythm going, that balance gets thrown off. And so one of the strategies to help people through that is to try to keep to a regular sleep routine. And I'm sure you're a younger person. I'm sure you know this well. I remember the day myself. It was hardly on my schedule to think of going to bed at a certain time every night. So I think that probably does a lot right there, because when you have that balance of serotonin and melatonin messed up, it just makes it so much harder for your body to adjust to the changing length of daylight. The days get shorter, but you're just not on the same pace with it to make that transition. Yeah,
and that's a great point, and that's why I think incorporating an exercise routine into your daily, schedule is going to be great, because exercise, like we said, like we talked about, has increased serotonin, those feel-good hormones, but because it increases that, it's also going to help improve your sleep. So that balance that Diane kind of touched on, that's really going to be balanced out with increased exercise. So I think that's a really great point there.
Absolutely. And as far as why women would be more likely to have seasonal affective disorder, I really don't have any data on that. Women overall are at higher risk for depression, and that might have something to do with, historically women's role as caretakers and trying to be attentive to everyone else's feelings and maybe ignoring their own self-care and their own needs. So my hunch would be that some of that is in play as well for women being more vulnerable for the seasonal affective disorder.
Definitely.
Right.
Awesome.
And
so one of the things that I always like to talk about going back kind of into the exercise thing, is, like I said, you want to start small. So making sure that these goals, like we've touched on, are very, very small getting started, especially if you're just kind of starting this exercise routine. You know, we're dealing with a form of depression. So of course, if we make a goal that's too big for us, or we bit off more than we can chew, that kind of might play a role back in kind of getting us into our depression hole and making us feel a little bit down on ourselves. So the key thing with starting a new exercise routine to combat seasonal affective disorder is going to be making sure that we, you know, stay small, we don't get down on ourselves. If you have an off day, like I said before, that's okay. Everyone's going to have these obstacles and barriers. No one makes a goal and gets there on a straight line and it's perfect and peachy. You know, we all have setbacks no matter who you are. So I think that's really important. Going back on the mental health aspect of it is to just always remind yourself, you started this, you can do this, you started it for a reason, really. So just remember what that reason is, remember what your why is, and go from there.
And that's exactly what we try to do too in the therapy, is try to remind people that, you know, all or nothing thinking usually gets us into trouble. Just, you know, setting a goal that's modest, that's reasonable, that is attainable is very, very good. It helps you to have that sense of accomplishment. And if you don't meet that goal, then spend a little time trying to think about, well, what are the barriers that kept me from meeting that goal, and what does that teach me? How can I tweak my goal so that it could be more achievable for me, instead of getting locked into judging ourselves and feeling terrible about ourselves. You know, we need to really be gentle and kind to ourselves. Yes.
Absolutely.
Exactly.
Absolutely.
Exactly. And as I mentioned, you know, sometimes a case of seasonal affective disorder causes such distress that it's really a great idea to reach out for either psychotherapy with one of the counselors in your resources, or to consider talking to your primary care physician, perhaps medications necessary. So for many of the folks who experience this on a yearly basis, they know that those 4 or 5 months are going to be really rough. And we're right in the midst of the worst time for many people right now. But the good news is too that the weeks are coming very soon here where we are going to be able to be outside again more and doing many more activities.
Yep, I sure hope so.
And so the question is, can SAD turn into full-on clinical depression? And it certainly is. It meets the criteria for clinical depression. It's just a form of clinical depression that happens to have a seasonal pattern to it. But you know, that brings up the idea too that oftentimes we think of just the winter blues. That's that kind of low energy, low motivation, wanting to sleep more, wanting some of those high carb sorts of foods. That's something that more people experience on a yearly basis. But most people are able to kind of push through that. It might, you know, might affect them a little bit as far as their normal day-to-day life, but for the most part, they're going to push through it. When we see it go into seasonal affective disorder, we know that that's creating difficulty in, say, carrying out your job duties, or you have a lot of difficulty carrying out your family responsibilities. That's when we know that it's gone to a level that meets the depression criteria.
Absolutely.
But the combination of, you know, exercise, light therapy, increased social interactions, working on your attitude to develop that healthy attitude, find the bright side of winter, find some of the positives in that. All of those things go a long ways towards helping seasonal affective.
Awesome.
And resources, it's a great question. Do you have any resources that people can turn to? And yes, we have another slide on that. So we have a variety of resources, both on the mental health side as well as on the fitness and well-being side.
Yeah, so one of the things for resources on the fitness side, obviously you can contact our workplace wellbeing and fitness department. It's not up there, but the TriHealth Pavilion, like I talked about earlier, they have really great resources. One of the things that I've had a lot of clients of my health coach clients say is they're finding it really hard to get exercise in because you know, it's a pandemic obviously, and they're not really comfortable going to a gym. It's cold, so they don't want to get outside. So what else could they do? So one of the things that we also have available is a YouTube fitness page. So you can always search for TriHealth Corporate Wellness on YouTube, and they have some really great home workouts that you can do. My colleagues have done a fantastic job with that. And then also just reach out to your local gym. your local, fitness, what you would do in normal times, quote unquote. And most gyms right now and most fitness services are offering virtual programming.
That's right.
So always do your research. Make sure, for one, it's a credible source, especially if you're heading to YouTube. There are a lot of people out there who claim to be fitness specialists, but always aren't. So make sure that you're watching a credible source and it's from a credible source. But those are always really great options too, getting on YouTube and contacting local gyms, things like that, to find resources.
Right. Excellent idea. Great.
Perfect.
All right. Well, thank you so much for joining us today. This has been a great opportunity to
absolutely
talk and give some resources. Be well.